Hello, my name is Alex Tovar. This presentation will discuss the effects of technology on a quality improvement initiative focused on central line maintenance in the pediatric intensive care unit. The goal of this project was to improve compliance with the evidence-based central line maintenance practices and reduce the risk of central line associated bloodstream infections, also known as CLABSIs. I will discuss the identified gap, how technology can support the intervention, the results of the project, and recommendations for sustaining the improvement. The goal of this quality improvement initiative was to increase central line maintenance bundle compliance in the PICU from 80% to at least 95% within 30 days. The project focused on making sure nurses consistently followed evidence-based central line care practices. These practices included dressing assessments, appropriate line procedures, and required documentation. A standardized checklist was introduced along with staff education to improve consistency. Improving compliance with these practices is important because proper central line maintenance can help reduce risk of CLABSIs and improve patient safety. The initial gap identified in the PICU was the central line maintenance bundle compliance was only 80%, which was below the project goal of 95%. Some staff members also forgot to complete the checklist, and the high acuity environment sometimes made documentation difficult. These issues showed a need for more of a reliable way to remind staff and monitor compliance. Technology can help address these problems by providing electronic reminders, standardized documentation, and easier access to compliance data. This allows nurses and leaders to identify gaps and respond to them more quickly. Several types of technology can support this quality improvement initiative. The electronic health record can be used to document central line maintenance and make required information easier to access. An electronic checklist can guide nurses through the required maintenance steps and reduce the chance of missing an important task. Electronic reminders can also alert staff when documentation or maintenance is due. In addition, quality dashboards can help nurse leaders monitor compliance and CLABSI trends. Overall, technology can make evidence-based practices easier to follow and incorporate into the normal nursing workflow. Technology can improve quality by making central line maintenance more consistent and easier to monitor. Electronic checklists can reduce missteps and documentation, while reminders can help nurses complete required tasks on time. Technology also allows leaders to review compliance data and identify trends more quickly. This is important because quality improvement depends on accurate and timely data. Research has also shown that electronic checklists and dashboards can improve compliance with central line maintenance practices. By combining technology with staff education and feedback, the PICU can create a stronger system for preventing CLABSIs. The results of the quality improvement project were positive. Before implementation, central line maintenance bundle compliance was 80%. After the 30-day pilot, compliance increased to 96%, which exceeded the goal of 95%. There were also no CLABSI events during the 30-day pilot period, compared with 2 events reported during the previous quarter. Staff also became more aware of central line maintenance expectations, and communication about line care improved during handoffs. Although these results are encouraging, the short pilot period means we cannot say that the intervention alone caused a reduction in CLABSIs. Based on the results, the next step is to continue the central line maintenance checklist and strengthen the use of technology. When possible, the checklist should be incorporated directly into the electronic health record. Electronic reminders and quality dashboards can also help staff and nurse leaders monitor compliance. Monthly audits should continue to identify areas that need improvement. Central line and CLABSI prevention education should also be included in annual competency training. If the improvement continues, this intervention could eventually be expanded to other pediatric units that care for patients with central lines. Thank you for listening.